The VA Compensation and Pension or C&P exam for urinary incontinence is a critical step in your VA claim. This exam is really the VA's way of gathering medical evidence to understand your condition. They need to see how your urinary issues are connected to your military service, and also, they need to know just how severely this condition affects your daily life. The results of this single appointment can honestly be the deciding factor in whether your claim is approved or denied, and what disability rating you receive. It's your chance to have a medical professional document the true extent of your struggles, so it's vital to be prepared and understand what will happen during the exam. The person conducting your exam is usually a doctor, a nurse practitioner, or a physician assistant. They might work for the VA directly, or they could be a private contractor hired by the VA. Their job is not to treat you or provide medical care. Their only role is to evaluate your condition and complete a Disability Benefits Questionnaire or DBQ for the VA. This form contains specific questions about your urinary incontinence. The examiner will ask you questions, review your medical records, and perform a physical examination. Think of them as a fact finder for the VA, tasked with painting a clear picture of your current medical situation for the VA rater. It's completely normal to feel nervous or embarrassed about this exam. Talking about incontinence is a very personal and often difficult subject. However, it's important to remember that the examiner is a medical professional who deals with these issues regularly. Your honesty and openness are crucial. This is not the time to downplay your symptoms or put on a brave face. The VA can only rate the problems that are documented in your file. If you minimize how often you have accidents or how much it disrupts your life, the examiner's report will reflect that, and your potential rating will likely be lower than it should be. Your main goal during the C&P exam is to provide a clear, honest, and detailed account of your condition. Think of it as your opportunity to tell your story to the VA through the examiner. They need to understand not just that you have leakage, but how it impacts every corner of your life. This includes your ability to work, your social life, your relationships, and your mental well-being. The more information you can provide, the better the examiner can understand the full scope of your disability. This detailed understanding is what leads to a fair and accurate VA disability rating, which is the ultimate goal of this entire process. The examiner will ask a lot of questions about your symptoms. They will want to know exactly what happens. For example, they will ask how often you experience urinary leakage. Do you leak urine every day, or just a few times a week? Do you leak a little bit, or does your bladder empty completely? They'll also ask what triggers the leakage. Does it happen when you cough, sneeze, laugh, or lift something heavy? Or does it happen without any warning at all, with a sudden, uncontrollable urge to go? You need to be ready to describe these situations in detail, giving the examiner a full picture of your daily reality. Beyond the physical symptoms, the examiner will ask how urinary incontinence affects your life. This is where you need to be very specific. Don't just say, "It makes things hard." Explain exactly how. Talk about how you have to plan your entire day around being close to a restroom. Mention if you've had to quit hobbies you once enjoyed, like running or hiking, because of leakage. Explain how it might affect your job, perhaps causing you to miss work or feel embarrassed in front of colleagues. Describe the impact on your social life, like avoiding parties or family gatherings because you are afraid of having an accident in public. A key part of the questioning will focus on what you use to manage the incontinence. The examiner must know if you use absorbent materials like pads or protective underwear. Be prepared to tell them exactly how many pads you need to use each day. For example, you might say, "I have to use 4 to 5 maximum absorbency pads every single day to stay dry." This detail is extremely important because the VA rating criteria are directly tied to how often you need to use pads. Also, mention the financial cost. You can say, "These pads cost me over $100 a month," to show the real-world impact. If you use any other devices like a catheter, you must tell the examiner. Explain what type of catheter it is and why you need it. The use of a catheter for incontinence is a very serious matter and corresponds to a higher disability rating. When answering all these questions, avoid simple yes or no answers. Always expand on your response. Instead of saying yes when asked if it impacts your sleep, say, "Yes, I have to get up at least 5 times every night to use the bathroom, so I'm constantly exhausted during the day." Every detail helps build your case. After the interview portion, the examiner will likely need to perform a physical exam. The main purpose of this exam is for the examiner to look for any physical reasons for your incontinence. They may check your abdomen, your lower back, and your genital area. For male veterans, this could include a digital rectal exam to check the prostate. For female veterans, it might involve a pelvic exam. The examiner is looking for things like nerve damage, muscle weakness, or an enlarged prostate that could be causing or contributing to your urinary problems. It's a standard part of the evaluation process. The examiner might also ask you to do certain movements to see if they trigger leakage. This is sometimes called a stress test. They might ask you to cough forcefully, bear down as if you are having a bowel movement, or stand up quickly from a seated position. They are trying to observe firsthand if these actions cause you to leak urine. While this can feel incredibly awkward and embarrassing, it provides objective evidence for your claim. If you do leak during this test, the examiner will note it in their report, which can be very powerful evidence to support your statements about your symptoms. It is extremely important to know that you have rights during this examination. You have the right to have a chaperone in the room with you. This can be a staff member from the clinic. You can request one before the exam begins, and you do not have to give a reason. Having another person in the room can make you feel more comfortable and safe. If at any point during the physical exam, you feel pain or are deeply uncomfortable with a procedure, you have the right to ask the examiner to stop. You are in control of your own body. Furthermore, you have the right to refuse any part of the physical exam. If you are not comfortable with a rectal or pelvic exam, you can say no. However, you need to understand the potential consequences of this refusal. The examiner must note in their report that you refused that portion of the exam. The VA rater might then decide that there is not enough medical evidence to grant your claim. It is a personal decision, and you must weigh your comfort level against the needs of your VA claim. You are your own best advocate in this situation. So, the VA rates urinary incontinence based on how well you can control your bladder and what measures you must take to manage the condition. The ratings are quite specific. A 20% rating is typically for veterans who need to wear absorbent pads and change them a few times a week. A 40% rating is for those who must wear pads and change them daily. The 60% rating is for veterans who have constant leakage or use a catheter to control their bladder. Understanding these levels helps you see why it's so important to be specific about how many pads you use and how often. To best prepare for your C&P exam, you should start gathering evidence well before your appointment. One of the most powerful tools you can use is a daily log or journal. For at least a week or two leading up to the exam, write down every single time you have a leakage incident. Note what you were doing, how much leakage occurred, and how many pads you used that day. You can bring this log with you to the exam to help you remember the details and show the examiner a consistent pattern of symptoms. This written record is much more effective than trying to remember everything on the spot. Another excellent preparation step is to bring buddy statements with you. These are written statements from people who know you well, like your spouse, a close friend, or an adult child. In these letters, they can describe the changes they have seen in you because of your incontinence. They can talk about how you have to leave events early, how you always need to know where the nearest bathroom is, or how it has affected your mood and personality. These personal accounts can provide powerful, non-medical evidence that supports your claim by showing the real-life impact of your condition. Finally, remember to be your own best advocate during the exam. Be honest, be detailed, and do not let embarrassment stop you from describing the full extent of your problem. If the examiner is rushing, you can politely say, "I have a few more things I need to tell you that are important." If you feel the examiner was dismissive or did not listen to you, make a note of it as soon as you leave. You can and should report a bad exam experience to the VA. This is your health and your claim. Go into the exam prepared and confident, and good luck.